Welcome to the Orencia experience. My name is Pam, and I have moderate to severe rheumatoid arthritis. I'm also a patient receiving Orencia. Through this video, I'll guide you through my own experience with the medicine. I'll introduce you to my support team, my nurse, rheumatologist, family, and friends, who play an important role in my treatment. They've been with me every step of the way. It's nice to know that I'm not alone when it comes to managing my RA. Navigate through scenes by accessing the menu page, or just keep watching. It's important to remember that not all infusion facilities are the same. Patients may receive infusions of Orencia in a rheumatologist's office, hospital, or infusion center, and your experience may be different than mine. Let me introduce you to my support team.
I'm here to tell you about how Orencia is given.
And I'll tell you about how Orencia works in the body and what makes it different from other RA treatments.
I'll tell you how Orencia has affected our life.
For me, the RA symptoms that I experienced were challenging, even though I was being treated for my RA. My symptoms made it more difficult for me to perform daily activities, like buttoning a coat or opening a jar. At my next appointment with my rheumatologist, Dr. Miller, we talked about what other options were available. He told me about Orencia as an option to consider. After carefully weighing the benefits and risks, we decided to try it. Why were we considering Orencia? I have moderate to severe rheumatoid arthritis. I wasn't helped enough by methotrexate. Once we decided to try Orencia, I became a little anxious about having an infusion, which is only natural. But my rheumatologist and nurse went over the process with me, which really helped address my concerns. They explained that an infusion is a process in which medicines are delivered intravenously, that is, through a needle placed in the vein in your arm. When I'm receiving my infusion of Orencia, I feel a small pinch at first, then just sit there for half an hour or so with my arm resting comfortably. I receive my infusion here at Dr. Miller's office. But some patients go to a separate facility, usually called an infusion center. Sometimes I bring music to listen to, and sometimes I enjoy talking to the other people here. I've seen other people who like to read or watch TV. And while not all infusion experiences are the same, here the nurse checks on me periodically during the half-hour infusion. After my fourth or fifth infusion of Orencia, I started to notice a difference in my symptoms. Together with the support of my team of family, friends, and the nurse, I feel like my rheumatologist and I are on the right track to managing my RA with Orencia. This is Deborah. She's one of the nurses in Dr. Miller's office, and she gives me my infusion of Orencia every 4 weeks.
Hello, my name is Deborah, and I've been a nurse for about 10 years. I work with Dr. Miller, and I've seen many rheumatoid arthritis patients. From my experience, I know that the disease can make daily life challenging, and finding the right treatment can take some time. Before treatment with Orencia, patients do not have to fast, avoid any particular foods, or receive any kind of special medicine in advance. Now, before Pam began her first treatment with Orencia, I took a full medical history and performed the appropriate tests. Now, before each infusion, there are a few questions I always ask to see how she's doing. I check to see if there have been any problems or changes in the last month, or if there's anything else that would keep her from receiving her infusion that day. While every infusion experience is different, I always make sure that Pam is feeling well, is relaxed, and comfortable. Then I get some information from her. First, I check her vital signs, things like blood pressure, pulse, and temperature. Then I ask how she is doing with Orencia. Has she felt stiffness, pain, or a difference in performing her daily activities? Next, I ask how she's feeling. For example, has she had a fever, any infections, colds, or other health issues? It's important to know if she's had any of these because an infection could put the patient at risk for serious side effects with Orencia. Finally, I ask if she's on any other medicines, including antibiotics. I note our discussion in Pam's chart. Based on our conversation, I will discuss with Dr. Miller to see whether it is appropriate to give her an infusion today or reschedule it. Now, this discussion is critical because Orencia can lower your body's ability to fight infection or make any infection worse. I always inform my patients with diabetes that the infusion of Orencia contains a type of sugar that may lead to falsely high readings with certain types of blood glucose monitors on the day of treatment. Now, we may recommend different testing monitors for these patients. It's important for patients to trust me enough to share any concerns or issues right up front, and I do my best to make sure she is comfortable sharing her thoughts and feelings with me. This is the medicine. As you can see, it's in a small bag. There's less than half a cup of liquid in there. Orencia can cause serious side effects, which can include serious infections and malignancies. Allergic reactions can also occur. The more common side effects with Orencia are headache, upper respiratory infections, sore throat, and nausea. An infusion of Orencia takes about 30 minutes. As the medicine is being given, I like to check on my patients during the treatment to make sure everything is going smoothly. Once the infusion is completed, I'll check my patient's vitals one more time, then she's free to leave. With Orencia, some patients may see an improvement in pain and other symptoms after the first visit, but many see an improvement after the first 3 months or so. Some of my patients who are in the clinical trials for Orencia are still doing well, even after 4 years of treatment.
Thanks, Deborah. This is my rheumatologist, Dr. Miller.
Pam has been a patient of mine for years. She was still experiencing the painful and uncomfortable symptoms of RA while on methotrexate. In fact, she was having problems just performing day-to-day tasks. When we began exploring other treatment options, we did set a few objectives: to lessen her day-to-day symptoms like joint pain and inflammation, to slow down the progression of her joint damage, to improve the health-related quality of life. While other options were available, we felt that Orencia would help us reach our goals. Every patient is different, however, and individual results may vary. It's important to know that patients may have a higher chance of getting a serious infection if Orencia is taken with other biologic medicines for RA. Orencia works in a fundamentally different way than any other RA treatment. It works early in the RA inflammation chain. This chain of events occurs when a person's immune system mistakenly attacks their own body due to RA. The immune system defends the body against infections caused